that we'll work to bring teams out there as well and help to support all of their efforts. So as soon as the federal government will provide us with more vaccines, we're ready to go ahead and help the governor and Dr. Christ in that endeavor.
Let's go to Megan with KOLD.
I have a follow-up.
Thanks, Dr. Carmona.
One second. So a lot of people, a lot of agricultural workers who are essential workers in this county, how are you guys going to make sure that they get the vaccine? Are you guys going to do like mobile clinics, or do they need to go to the state pod? I don't know who can answer that question.
Go ahead.
So Yuma County has been doing a lot of outreach directly to our migrant farm workers and our agricultural companies. They have been offering both occupational-based, so employer-based vaccination strategies, as well as taking mobile clinics. The University of Arizona also has a mobile clinic that they've been going into those communities to vaccinate our migrant farm workers as well.
Thank you.
Megan.
Thanks for being here today, Governor. This question is for you. The Board of Supervisors here in Pima County is asking you to reconsider denying the FEMA site. So will you reconsider denying that?
Yes.
Why? And when could we maybe see that if it is reconsidered?
I just want to say my objective is to get the vaccine out. We've been working closely with the federal government. Dr. Christ has an idea of how to stand up these mass vaccination sites. Dr. Robbins and Dr. Carmona as well. We're going to stay focused on distributing the vaccine. I'm going to revisit this issue because the Board of Supervisors feels so strongly about it. But the objective is going to remain putting shots in arms.
If I could have a follow-up with Dr. Chris. So I have a letter here from FEMA sent to you by Tammy Luttrell, the acting regional administrator, and she says that really all of your hesitations for not having this FEMA site for vaccine supply integrity, oversight, and customer experience really just aren't true. So what was your reasoning for having those hesitations for the FEMA site, and have you reconsidered after interacting with her?
So we have a great partnership with Tammy and our FEMA partners. There were many concerns on why they felt that they couldn't just give us the vaccine, but that they needed to set up an entire site outside of our already state distribution. Some of those concerns we have heard voiced from other state counterparts who already have those FEMA existing sites in place. And there is a significant list of resources that the county, and if not the county, then the state would have to come up with, and that includes the cold chain storage, the pharmacy support, the vaccinator support, the communications, the registration system. There's a huge list of what the state has to provide in order to operate that. We already have a lot of that infrastructure in place, where all we would need to do is add a couple of hundred appointments to each hour, and we would be able to significantly increase the capacity if we just got the vaccine without having to add additional resources. It will take FEMA a while to mobilize as well, so by the time we start to get that vaccine, we could have gotten it out quicker through this than by the time they set up a site and get it running. I mean, we were surprised by the lack of demand last week. We're hoping that opening it up will continue the demand for several weeks, but by the time they got here and fully operating, we could have had already vaccinated huge numbers of people with that same vaccine.
Okay, let's go to Colleen from Channel 12 and then Tim from the Star.
Thanks for both of y'all's time today. Appreciate it. I know you guys have both addressed this FEMA letter issue, and both of you have said that if you had the supply, you could stand up more appointments and such. FEMA says that they have an 8-week supply that they could bring to this site, so they have the supply. Is it frustrating at all, that it would go to this, their specific site rather than just giving it to the state now?
There's no turf war here. We're in the business of distributing the vaccine. Dr. Chris just took you through the sites that we already have standing up and the people and resources that we have that are on site. FEMA's not providing that. We need supply. We need vaccine. It's pretty simple. Get it to us and we'll get it in people's arms all over the state.
Well, it just sounds like they have that 8-week supply, and
So they should deliver it to the state.
and then also, obviously, Dr. Christie mentioned on Monday and again today that you were surprised that, there was kind of a lack of demand, 58,000 appointments available. Obviously there was a lot of demand today, no surprise there with how many more Arizonans were eligible. How do you see, as you go forward, being able to reach what we need, to get people vaccinated and hopefully see the end of this pandemic?
That's a great question, because right now we've got about 50% or 55% of our state that wants the vaccine. They'll come and wait in these lines and get it, but we want to vaccinate more. So part of it is spreading it far and wide. It's building confidence that the system is convenient and that it works. I keep beating the drum that the vaccine is safe, it's effective, and it's free. President Biden's gotten the vaccine, President Trump's gotten the vaccine, Vice President Harris, Vice President Pence, Dr. Kara Christ, the coronavirus task force. I got my second vaccination today. So we only have 13% of our population, according to our focus work, that says no thank you. I will not receive the vaccine under any circumstances. So part of it is what you're seeing right now today. It's also been a little bit bumpy. While we had a lot of appointments available yesterday, today with the expansion of people available for the vaccine, there's no appointments available. So it depends on the days people are off, on weekends, on evenings. As we have more supply, we can run a 24/7 vaccination site for 24 hours, and we'll have many more people vaccinated. We're also working in our minority communities with the faith-based community. We also are told that if somebody hears from a subject matter expert, like a healthcare provider or a medical doctor, they're more inclined to make that decision. So all of those things through public service announcement and public education will have us getting more people vaccinated, whether it's in sites like this or us actually going in mobile settings, as Dr. Chris referred.
Let's go to Tim with the Star, please.
Hello, Governor. Last week at Douglas, you described the situation at the border with regard to migration as worse than it's been during your entire time as governor under 3 different presidents. Yet here, like in Tucson and in Douglas, where you were, in several other border towns, we just don't see that. We had a